Hello there. Welcome to my show, COVID-19 update by Heerak for December 4, 2020. It's the first week in December, and we have 21 days to go until Christmas. Yeah, I'm sure everybody's looking forward to Christmas. Obviously, Blackjack is where 21 is the winner. But today is actually National Dice Day. So we see 6 and 3, so we have 9. Um, if you're going for the largest number, you want 6 and 6, that would be 12. But you can get different combination, right? So you roll the dice and see. Um, but unfortunately for United States of America, the dice roll has rolled an unlucky number, and that number is 2,876 COVID-19 death in one day in USA. In 24 hours, we had 2,876 people die in America, in the United States of America. Right now, we are experiencing more than one person dying uh, at a phenomenal rate. I mean, you could do the math, but how many people are dying every minute? I mean, you could do the math and see how many people in America are dying in every minute. Um, but as I predicted, as you know, I'm Heerak, independent candidate for U.S. Congress in Virginia's 8th District, although I'm a lifelong Republican, and I may actually run for the Republican primaries in year 2022. Republican primaries will be in March 2022, most likely. And I believe I can quench the Republican ticket for US Congress in Virginia's 8th District. So I may run as a Republican. I mean, I have over 1 year to decide, but that's an option. Um, so I'm a candidate for US Congress in Virginia's 8th District for November 8, 2022. That's 2 years from now. And from now until then, we're going to have COVID-19. Um, and it's going to be killing a lot of Americans, unfortunately. So you may not be alive to vote for me if you live in Arlington, Alexandria, Falls Church, and Fairfax County. Um, Hopefully, you'll make the right and smart decisions, and then you'll survive COVID-19. The thing is, there are a series of unfortunate events that sometimes happen in history that creates tragedy. So, like when we look at Spanish flu pandemic of 1918, first year of the pandemic, not that many Americans died. But the second year of the pandemic, a lot of Americans died. So the question is, did more people die in the second year because it's a spread to more places? Or did more people die because a lot of Americans took vaccines that didn't work, but it may have had side effects that made them vulnerable to death from Spanish flu? Now, obviously, just like Americans today, Americans in 1918 were thinking that the vaccine would be their hope. So a lot of Americans took the vaccine if they could. Um, One thing is clear, the vaccines did not work. Um, but one thing is not clear, and that is if the vaccine contributed to a greater death rate. Um, it's hard to research, obviously. So one way maybe we can track this in COVID-19 America is keep a very good record of everyone who receives the vaccine and see what happens, right? It's in everybody's interest to know what the vaccines are doing. So everyone who gets the vaccine should be monitored very actively. So let's say you give vaccine to 1 million people, and every one of them are monitored every second of the day or every day. And if all 1 million do not get COVID and they survive, um, by this time next year, year 2021, you can give the vaccine to a lot of people and people can trust it. If the 1 million people got vaccine from December end up not getting COVID and they don't die from now until December 2021. So that is one way to know whether the vaccine is working, right? You got to keep track of everyone who receives the vaccine because COVID-19 may be forever, meaning we may have more people dying next year around this time than this year this time. So it is important for everyone to know whether the vaccine works. And there are several different types of vaccines, which vaccines work, if they work, which vaccines don't. Um, it's possible none of the vaccines will work. Also, it's important for Americans to know which vaccines have side effects that kills people. Let's say 1 million people take COVID-19 vaccine, and out of them, 100,000 die by 2021, then there's a problem. It doesn't matter what they die of, like they could die of heart attack, they could die of stroke, because it may not be natural to have so many people get heart attacks or strokes, right? So maybe it was a side effect of COVID-19 vaccine, right? So it's important to track who get the vaccines and how many of them are alive by this time next year. Um, as you know, I do not trust the vaccine because it's rushed. Number one, because it was rushed, I don't trust it. Number two, I don't trust any of the vaccines, Moderna vaccine, Pfizer vaccine, biotech vaccine. I don't trust any of them because all of them are making billions of dollars. They have a reason to lie to make the money or fudge the truth to make the money. Wherever there is so much money involved, it's hard to trust because they may be fudging the numbers to make the billions. You see what I mean? They're going to get rich off of this virus vaccine. So that's the second reason when there is alternative motive for pushing the vaccine through, because they could always say, oh, it worked in the lab, but it didn't work in real life. Hey, we're sorry. How companies are. I'm sure you watched the movie Eric Bronkovich, right? Companies do all kind of unethical and shady stuff. So why should we trust biotech, Pfizer, and Moderna vaccine makers when they have billions of dollars they're going to make out of this? It's like the goose that lays the golden egg. That's why I don't trust this vaccine because there's so much being thrown at the big pharma. Whenever there is money involved, it's hard to trust. I mean, there are cases where people make money, but they give you good products, like Amazon. I trust Amazon because Amazon has delivered constantly, again and again and again. So I trust Amazon. Like Amazon products that I order, they work fine. Whenever I order stuff from Amazon, they arrive within like 1 or 2 days. Um, and you can return the stuff and you get credit right away. So I trust Amazon because I have a history with Amazon, and many of you trust Amazon as well. That's why Amazon's making so much money, right? Because they're reliable, and they're reliable time and time again. um, but I mean, so who knows, maybe one of these vaccines may work. I don't think they will, but I'm open to being happily surprised because I wish that they would work. I just don't think they will work because of these factors that I'm saying. Third reason why I don't think the vaccine will work is there are too many strains of COVID-19. So I don't think the vaccine will cover all the strains. And because Americans are traveling around all over the place, all these strains are mixing everywhere in all 50 states. So we have thousands of strains. And can the vaccine protect against thousands of strains? Probably not. So what I'm most worried about, that's number four, is the vaccines tend to be like a RNA virus, and there has never been an RNA virus from what I understand. So it's an experimental virus vaccine. So it's an RNA vaccine. And RNA, they mess around with DNA transcription. So the biggest problem that I see with this experimental vaccine that we're going to be seeing is they're they're messing around with your DNA creating mechanism. Uh, if it works, great. But the problem is, even if it works now, it can create problems for you down the line, like 2, 3 years from now. So you may survive COVID, but you may get cancer and die from cancer. I don't want to take a vaccine that's going to mess around with my DNA creating mechanism intentionally. So I may survive COVID today, maybe in year 2021, but by year 2022, my DNA creating mechanism has become so problematic that I get cancer from the vaccine. I don't want that. And I don't know if that's going to happen or not. That's why I just don't trust the vaccine because it's too experimental. They don't have enough data and research on RNA vaccines. Um, Whenever you mess around with cellular formation, transcription, you're asking for trouble. You know, because that's how cancer is formed, right? When they when the when the when the genes are messed around with, you don't know what's going to happen. Because the reason that you get cancer when you smoke is because when you smoke, it alters your body. It impacts your body in ways where the cells start growing abnormally, right? The smoking itself, um, and like when you breathe in, polluted air, or when you have too much UVA light in your body and you have fair skin, white skin, you can get skin cancer. So when you take a vaccine that's messing around with your DNA creating mechanism, the problem that I see at this point is that it can create cancer. So you would not have gotten cancer had you not taken the vaccine. I'm not saying that will definitely happen. I'm just saying that there is a danger and there isn't enough research on it for me to trust it. You see what I'm saying? I mean, I wish I could trust this vaccine. I mean, if it works, obviously I'd love to take it, but there are too many question marks, and you can't undo it once you take the vaccine. It's already in your body and doing all kinds of stuff. So that's the problem right now. There isn't enough data, research. There isn't enough evidence-based research on real human beings and real settings that it's hard to trust. As you know, I'm a clinical nurse leader, nationally certified, and we use evidence-based research to improve the hospital unit, to improve the society. And evidence-based research, by definition, you have to have real life scenarios. Like you have to have people getting vaccinated in real life and observing them for like months, maybe years, and then reporting on them. That's evidence-based research. And clinical nurse leader, that's who I am. I've been trained in evidence-based research at Georgetown University, which is the best Catholic university in the world and one of the best universities in the world. 2-year master's program, and I graduated in August 26th, August 24, 2022. August 24, 2020. So I know the latest research techniques in evidence-based research. I know the latest cutting-edge methodologies in clinical nurse leader um, expertise, right? Because I just graduated from the program and they use the latest stuff. So using my expertise as a clinical nurse leader, I need evidence-based research. What is conducted in a lab is not evidence-based research, it's lab research. You see the difference between lab research and evidence-based research? Lab research is like you could conduct experiments on a mouse, or you could even conduct experiments on a human being, but in controlled settings. They're not in the real world, really. Um, and so evidence-based research is like you have real people experiencing real sickness, and then you try different treatments and see which one works, right? So the first batch of people getting vaccinated, they will provide evidence-based research months from now or years from now. You see what I'm saying? Before we have the evidence-based research, it's difficult to trust the vaccine. You see what I'm saying? We need evidence-based research. And Johns Hopkins University has done some important work on evidence-based research. So I'm kind of surprised that Johns Hopkins is very silent on this vaccine question, because by definition, you do not have evidence-based research until you actually tried it out in real setting, real life. Um, so we do not have any evidence-based research right now. We just have lab research. And that's why I don't trust it right now, unfortunately. I mean, I wish these vaccines would work, but I'm just saying that there's a lot of doubt. And the problem is sometimes side effects can kill you. You know what I'm saying? I mean, it depends on how bad the side effects are. And so that's my biggest fear is, what's going to happen in real life. And so obviously we have zero data on evidence-based research. So being that we're trained in evidence-based research to use that to improve life, society, and hospital, I cannot recommend these vaccines because there's zero evidence-based research data um, on these vaccines because they haven't been tried in real life. And that's why I cannot recommend them, unfortunately. Um, and as I've laid it out, there are potential dangers, meaning you can become immunocompromised. I mean, these are RNA vaccines, some of them, I guess most of them, and they're highly experimental. And no one knows if you're going to become immunocompromised by the vaccines or not. I mean, there isn't any evidence-based data right now. Because it takes time, right? From the moment you have HIV to getting AIDS, it takes time. You don't get AIDS right away. You know, from the moment that your cells start kind of malfunctioning to when you have, cancer that's detectable, it takes time. You know what I mean? So, um, so in the same way, if the vaccine has some side effects or harmful effects, you're not going to know for a long time, maybe months, maybe years. So that's why it's a problem right now. I wish, you know, I could honestly and confidently say, hey, go take the vaccine, but I can't because number one, we know there are side effects, but we don't even know what they are, right? Right? These vaccine companies are not being honest with us. So in the lab situation, there are side effects, and we don't really know what they are. because they're being so secretive, right? So that's a problem, when you have people being too secretive, you really, it's hard to trust them, right? Um, so that's where I am right now. My prediction is none of the vaccines will work. Obviously, I'm hoping I'm wrong. I wish I was wrong, right? I would love to be wrong on this. Um, but I mean, I don't think I will be wrong on this. That's the problem, right? Because there are too many factors that that come together to show that the vaccines will not work. And the problem is, if the vaccines just don't work, then you could just take it, right? Because hey, no harm, no foul. The problem is, no one knows what kind of side effects the vaccines will have. No one knows, right? In real life setting, like if you have diabetes, what kind of side effects will you have? If you had stroke before, what kind of side effects will it have? If you have hyperthyroidism, what kind of side effects will it have? If you have Down syndrome, what kind of side effects will it have? If you are taking, Prozac or some kind of, medication, what kind of side effects will taking the vaccine have? I mean, there are too many question marks. And there are a lot of Americans taking all different kinds of medications. And that's why I cannot recommend this vaccine because, I mean, we don't know what it's going to do. You know, if we have time, obviously, you try things out slowly. And then, people who get vaccinated will sign a waiver saying, I understand I could die from it, blah, blah, blah. And, and then we'll see a few people die and then they'll stop it. But the problem is, let's say they start mass vaccinating people, and it is found out like 6 months later there's something that is wrong. It's too late, and so that's I don't want to be in a situation of irony, right? They vaccinate to save you, but the irony is that the vaccine that you receive makes you immunocompromised. So that's the biggest danger I see. Because if you become immunocompromised, not only can you die from COVID, you could die from like flu, you could die from cold, you could die from all kinds of stuff. So that's the danger. I mean, if you get vaccinated and the worst that could happen is that it doesn't work, then obviously, it's not a problem because, no harm, no foul, but there could be side effects. That's the problem here. Um, as I said, I wish I'm wrong, but I feel a duty to you as the public to raise these questions that are critical questions because we live in a democracy where we have a freedom of ideas. We are supposed to question authority. We're supposed to question everything. And every person has the right to decide what he or she wants or doesn't want. And so, in keeping with American tradition of democracy, I feel obligated to raise these questions that are legitimate questions. Uh, and obviously, journalists should be asking these questions because that's what they're supposed to do. But unfortunately, they're like CNN has become a champion of the vaccine, and they're not asking the critical questions. So journalism has gone down the hill, and they're just kind of perpetuating like stereotypes are perpetuating um, what the authority wants. That's the authority wants you to take vaccine, and the journalists are going to back them up blindly. And so that's the problem I see with CNN, New York Times. These journalists who are not asking the critical questions. Um, so times have changed. During time of Nixon, people go out of their way to question authority, question government policies. All these movies about government, secret government, scientific experimentations, right? You've seen all those, right? All these movies, a Universal Soldier, things like that. But that generation has gone, right? The generation that questions the authority of the government or sees government as good, but they could also be bad in certain instances, or certain factions can do certain things that are wrong. It's kind of like Born Identity, Born, um, with Jason Bourne, the movie character with Matt Damon. Um, it kind of questions government programs. So the fact that CNN and everyone just kind of accepts the vaccine program as working, the fact that they just blindly accept all the data without critical questioning seems to me a little bit strange. Um, it's almost like they want something to save them, so they're not going to question it. They're not going to ask any critical questions. And for me, that's a problem because what if there are side effects? What if people with certain conditions end up dying directly as the result of taking the vaccines? These are questions we must ask, um, because we don't want to experience an irony where people who would not have taken the vaccine would have survived COVID just by locking themselves in their home and not going outside. They take the vaccine and they become immunocompromised, like their immune system becomes weak, and then they end up dying from a common cold that they would easily survive. That's the biggest worry that I have for the American people, the what if factor. And so obviously, we're not going to know whether it works or fails until people take the vaccine and then we have like months and years to observe. But I think everyone needs to agree that whoever is vaccinated must be monitored actively. I think that everybody agrees with that because COVID-19 can be forever, meaning year 2027, we may still have COVID killing 3,000 people per day. Um, we don't know, right? There's just this virus is an unknown. So I think we should assume that this is going to continue until year 2030, maybe year 2040. We need to keep data because if it does continue until 2030, we need to know what works, what doesn't work, what kind of problems arose, because we can try to fix the bugs and perfect the vaccines, right? And it may take us like 5 years to perfect the vaccine, 10 years to perfect the vaccine. We don't know. Um, but HIV virus is forever. It's been around for decades and kills hundreds of thousands every year. Hepatitis C virus has been around and it kills like hundreds of thousands every year too. So, I mean, there's no reason to assume that COVID-19 is going to go away. I mean, obviously, it'd be great if it goes away, but you can't assume it. You can't assume that it's going to go away. Just like you can't assume HIV is going to just go away on its own. Hepatitis C is going to go away on its own. You just can't assume it. Um, maybe you will never be able to have this kind of happy moment. I shared with you yesterday, um, going to Austrian Alps for skiing with Cambridge University students. And, I went there and I met some local yokels, some Austrians. Don't they look Austrian to you? And, I befriended with them and spent some time with them and had a lot of fun with them. Um, so you see the photo, but maybe those times are finished. Many of the European countries are forbidding their citizens to go skiing or go skiing outside of their country. Um, and if COVID-19 is forever, this could be like every year for next 20 years. Who knows? Um, When we look at U.S. death, we have 2,876 people who have died in the last 24 hours. Our death rate is at 278,605. And my prediction is coming true. I predicted that the death will eventually double, and then we're going to have 5,000 people die per day in America, and that it could be as early as next week. You see, we're almost at 3,000, and then we're going to go to 4,000, then we go to 5,000. So by next week, Friday, we may have 5,000 people dying every day from COVID. My prediction is that before Christmas, December 25th, 2020, there will be 10,000 people dying per day. That's my prediction in America. I hope I'm wrong, but I don't think I'll be wrong. You may have to bury your child, like in the photo behind me. You may not have that happy Christmas with your child. Your child may be buried after dying from COVID. That's a possibility. Um, yeah, I mean, look at all these people dying. We're not talking about fiction here, right? We're talking about reality. That's somebody's child, that's somebody's mother, that's somebody's sister or brother, that's somebody's friend, that's somebody's wife, right? Um, that's died. That's in one day. 2,876 people have died in one day. And as you know, COVID-19 is filling up ICU beds. After it's packed, they'll have to turn away patients, in which case, 100% of the patients who need ICU beds can die. Can you imagine when that happens? It could happen in December, it could happen in January. So if there are 50,000 patients needing ICU beds in 24 hours and there's no ICU beds, all 50,000 can die in one day. Um, because there's going to be more and more people getting infected. How many states have shut down right now? None. So cases will continue to grow in America because none of the states shut down. There are a few cities who shut down, but none of the states shut down, and people go in and out of the city all the time. And yeah, so we don't know what's going to happen, but we have 6 months of COVID-19 death left. We have December, January, February, March, April, May, June, right? Maybe more than 6 months. So if we maintain death at 10,000, that's like what? 300,000 deaths every month. But if it goes up to 30,000 deaths per day, um, it could be like 1 million deaths in a month. We don't know what's going to happen, right? All we know is that deaths are spiking in every state. And it's highly likely we're going to hit 10,000 deaths per day before Christmas. And then after Christmas, we still have January, February, March, April, May, June. Do you remember how April was in New York? That's the way April will be for every state in America, every city in America. Um, that's in April. And things are going to be worse in January than April, because April is warmer than January. So you can't imagine what's coming. Yes, I mean, make this Christmas celebration very special. Put Christmas lights. If you're at home, do a lot of Christmas stuff with your children, because this may be the last month that you spend with your children. Either because your children die or you die. There's a lot of death coming. That's like 100% certain. The question is how many? Is it 10,000 per day? Is it 50,000 per day? Is it 100,000 deaths per day? You don't think 100,000 people could die per day? Of course they can. Why do you think that 100,000 cannot die in a day? It's a killer virus that kills. It could choose to kill 100,000 people per day in America. I mean, there's no science that says a virus cannot kill 100,000 per day, right? There's no scientific rule that says viruses are forbidden to kill 100,000 people per day. It can happen. Ask Dr. Fauci, of course it can happen. Every scientist knows it can happen. Um, yeah, it's sad, but it's real. In Europe, you have Russia with number one for cases, 2,382,012 cases. Um, and the death is 41,730. And France is number two with 2,321,703 cases. Death is at 54,859. United Kingdom is number three at 1,694,800 cases with 60,714 deaths. So you see, United Kingdom's death rate is at 4% now. Last year in April, it was like 12%. This year, it's going to be far worse. We may have 20% of everyone who gets COVID die in United Kingdom like in January. We don't know. We don't know yet. Let's see. I mean, it's wait and see kind of thing, right? We just don't know what's going to happen. Um, I mean, it's not like you're getting decapitated, at the neck. But that may be less painful than dying from COVID, to be honest with you. Because COVID brings a lot of pain, from all accounts of people who died from COVID in April. It's a very painful way to die. Whereas decapitation, they just cut your neck and you die. You may experience pain for like a few seconds, but you're dead. COVID-19 pain is like days of pain, weeks of pain, months of pain, and then you die. Yeah. It's like being tortured before your death. So it's it's not going to be pleasant for people who get COVID and end up in ICU and then you end up dying. Um, Italy is number four for COVID-19 cases, 1,688,939 cases, and the deaths are at 58,852. Spain is number five with 1,684,647 cases. Death is at 46,252. So you see deaths are rising aggressively in Europe. So they may beat out Latin America as the continent of COVID-19 death. I'm predicting that every one of these countries will have over 1 million people dead by January 2021. Maybe more than 1 million, maybe a few million, let's see. I'm hoping I'm wrong, but I don't think so. I'm predicting that there will be 100 or more COVID-19 deaths around the world by June 2020, and about 30 million Americans will die of COVID-19 by June 2021, actually, 2021. So we have December to go, January, February, March, April, May, and then June. So yeah, I mean, it's definitely possible. We all have 100 million people die in the world. Unfortunately, it's possible. So, today, as you know, I grew up in Pennsylvania, Philadelphia, Pennsylvania. So I thought maybe, going back to my roots, talk about Pennsylvania a little bit. I went to Philmont Christian Academy in Montgomery County in Pennsylvania, which is like the COVID-19 hotspot. I actually went back to my high school reunion in December 2019 and had really a lot of great conversations with Mr. Bacon, who was our science teacher, physics teacher. I've talked with like other teachers there. Mr. Struck, who's our gym teacher. I talked to Mr. Sorgness, who's a history teacher. Yeah, we talked about a lot of interesting stuff, I think, which is relevant to what's happening right now. Hi, Mr. Bacon. Hi, Mr. Struck. Hi, Mr. Sorgness. Um, Yeah, I really respect my high school teachers. It was good to see them. I mean, they look the same. you know, they haven't aged a bit. They look the same, which is kind of interesting. Um, yeah. First article is Pennsylvania shatters record for new COVID-19 cases with over 11,000. Allegheny County tops 1,000 for the first time. So one county has 1,000 cases. So that's to say, like each case, each county is becoming COVID-19 hotspot. It's aggressively spreading, which means a lot of people can die in every county. So this was on December 3rd, yesterday. WPXI 11 News, written by staff. Significant quote is this: the Pennsylvania Department of Health reported a record setting jump in new coronavirus cases in the state with 11,406 new cases. That's like in one state, 11,000 cases. That's crazy, right? Um, because if a flu season 10% death rate, that's like 1,400 dying every day. You know, weeks from now. So 1,400 of people who get COVID will die. You know, within several weeks. You see what I'm saying? And then tomorrow's case, that's like that. So just in Pennsylvania, and we have 50 states. Do you see why I'm predicting that 30 million people will die in America by June? I hope not, but you see how we can get to that. Um, yeah, since the pandemic began, there have now been 386,837 total cases statewide. According to the health department, there are currently 4,982 people hospitalized from the coronavirus. 1,048 of them are in the ICU. The health department also reported 187 new deaths statewide. So Pennsylvania has like 200 people dying every day. In 10 days, you have 2,000 people dying. In 1 month, you have 6,000 people dying. Now, if it doubles, in 1 month, you have 12,000 people dying in Pennsylvania. And if it doubles from there, you're gonna have 24,000 people die in the state of Pennsylvania in 1 month. So, and we don't know how quickly death will double, right? Obviously, a lot of people are dying. Second article: COVID-19 hospitalizations on the rise across Delaware Valley. This is by Jeff Chirico and Corey Davis on 6 ABC Action News, yesterday's article. So the significant quote is this: Montgomery County Commissioner, this is in Pennsylvania, Val Arkush said during a recent press briefing that space for patients in hospitals is becoming scarce and the demand for healthcare workers is increasing. Almost every hospital is at capacity. There are two that aren't, but the remainder are quite full, said Arkush. That is usually triggered by the emergency room being full. The reason the emergency room are full is because they can't move patients out of the ER. Open beds and available staff are quickly dwindling. And unlike in the spring, medical staff from the National Guard or other states aren't available to help. Yeah, so what this is saying is hospitals can run out of space. Yeah, it's going to be horrific. I'm predicting 1 million people minimum will die in the state of Pennsylvania, unfortunately. Because look at what's going on. And this is only beginning of May. We have like whole month of May. And then we have January, February, March, April, May, June to go. Of course, 1 million people could die in Pennsylvania. In one county, the cases are spreading aggressively. You could have 10,000 people getting COVID in one county per day. Oh, geez, you don't know. I mean, sky's the limit with COVID-19 infections. I mean, there's no limit really. We have 30 million people to go. And there's no rule that says, half the country cannot be infected with COVID with a 10% death rate. There'll be 150 million people getting infected and 15 million people dying. There's no rule that says, that's not possible. There's no rule that says, 40% of everyone who gets COVID starts dying when hospitals are full and nurses dying in large numbers. There's no rule that says that. Anything could happen. We so we're boldly going where no man has gone before, in some sense. Um, yeah, this is number 3 article. LVHN has more COVID-19 patients than ever. Hospitalization surging across Pennsylvania. This is by Steve Novak, Lehigh Valley Live, December 3, 2020. That was yesterday. Um, so the article is, as Pennsylvania coronavirus cases surge this fall, it's still fall, right? So do hospitalizations. As of Wednesday, 4,982 or 4,982 COVID-19 patients were hospitalized across the state. For comparison, there were 2,800 COVID-19 patients hospitalized at the state's springtime peak in April. So it's like double almost, right? So situation is far worse now because it's spread everywhere. That's why. And you can imagine death rate will start skyrocketing. We're still in the fall season. And, when winter comes, I mean, who knows? You may have 20% of all COVID patients die. We don't know what's going to happen in the winter, right? Because, this is the first full winter we're going to experience with COVID. We don't know what's going to happen. Um, yeah, so it's bad. Um, Hospitals have been told to be ready to share resources as state health officials have repeatedly warned of protections um, that show the state running out of intensive care unit beds as soon as this month. So imagine this. Parts of Pennsylvania run out of intensive care units this month. By January, every single hospital in Pennsylvania, because they're all sharing now, right? Every single hospital runs out of um, intensive care unit. And then what's going to happen? You have January, February, March, April, May, June to go. 100% of the people who need intensive care unit can die. I mean, I'm being conservative by saying 1 million people will die. I mean, if 100,000 people in Pennsylvania need ICU and there's nothing, all 100,000 people can die. You see what I'm saying? And that could be over like, if you have 10,000 people getting infected, that's 10 days. You have 100,000 people infected. And if all of them need hospital during winter and there's no more ICU bed, all of them can die in 10-day period. 100,000 can die in Pennsylvania. You see what I'm saying? In California, you have 20,000 people getting infected in a day. In 10 days, you have 200,000 infected. If there's no COVID-19 ICU beds, 200,000 people could die in 10 days. Why do you think that's not possible? And you have it's only 10 days, 1/3 of a month, and you have January, February, March, April, June, April, May, June to go. Why do you think millions of deaths is not possible in America? It's not a straight 2+2 calculation here. Once intensive care units are full, 100% of the people can die. Right? You got to calculate it like that. That's why we call it social science. This is not a mathematical math, pure math, right? Because pure math doesn't take into consideration sociological factors, geographical factors, topological factors, demographic factors, right? Um, that's why math is not accurate. That's science is not 100% accurate because they don't take into account human human factors like nurses dying, nurses being short in a hospital, ICU beds running out. Scientists do not take these things into consideration. Social scientists do, like historians, they do. Because obviously you may only have 2% dying, let's say 1,000 people get it, 20 people die. But once there's no ICU bed, all 1,000 can die. So historians consider these options, but scientists don't. That's the problem, right? That's why scientists are always underestimating and they're always wrong. They have to keep revising because they're underestimating, because they're not taking the social factors into consideration. Um, yeah, science is limited. Sometimes scientific truth is not the accurate truth. Sometimes social scientific truth is more accurate than scientific truth. You see what I mean? It's all relative based on the situation you're experiencing. If there's no friction, if everything happened in a vacuum, science may be right all the time. But nothing happens in a vacuum. There's always friction. You have to calculate gravity. You have to calculate. I mean, geez, a lot of unknown factors you can't even calculate. Um, yeah, things are bad. Um, yeah, I mean, I am sticking by my prediction that there's going to be about 30 million Americans die by June 2020. It's tragic. I'm hoping I'm going to be wrong, but you see why I am likely to be right, right? I'm explaining the situation to you based on evidence-based research, social scientific methodology, and rationalism, common sense, plus logic, plus rationality. And Aristotle and Plato talked about reasoning and logic and rationality, right? And some of what they've taught is timeless. It's applicable today, just as it was applicable over 2,000 years ago. Um, so when scientists predict we're not going to have that many deaths, they're not taking into consideration human element, human factors, and that's the tragedy. Is you cannot exclude human factors, in any calculation. And that's why this show is so valuable. That's why I'm sure Dr. Fauci is watching this show, Dr. Han from FDA, Dr. Redfield from Center for Disease Control, Dr. Sanjay Gupta from CNN, Dr. Gottlieb, former FDA director, Bill Gates and Melinda Gates. I'm sure they're all watching this show because I offer critical assessment as someone who is the Leonardo da Vinci of 21st century, right? I make sense to you because most likely I'm right. You see what I'm saying? Um, yeah, I'll keep you updated. So keep tuning in. This is a daily show. And my goal is to try to save you and your children from COVID-19 death. Obviously, you do what you want, but I always try to provide some recommendation to help you survive. Obviously, the best way to survive this COVID is locking yourself in your home and engaging in activities with your people in your home, your own household. Have an exercise bike or treadmill or ping-pong table at your home. Get the exercise that you need at home. If you have a front yard and a backyard, run around in your front yard and backyard. You don't have to wear a mask, right? As long as you're only running around in your front yard and backyard. That's why, national mask mandate is stupid. Biden wants everybody to wear a mask for 100 days. What an idiot. I'm sorry, Mr. Biden. I should call you an idiot, but I mean, there are a lot of people who live in the suburbs in America. As long as they're not going to their neighbor's home, they don't need a mask. They could just you know, I mean, why do you not need a mask when you're like in your backyard? If you have like a half acre backyard or a quarter acre backyard or 1 acre backyard. Why would you need like a mask in your backyard? You don't need a mask. Um, yeah. If you're just with your household and nobody in your household is COVID, you don't need a mask. Are you wearing a mask at home right now? You see what I'm saying? Um, yeah. Anyway, I'll bring you more data that you need tomorrow. So, tune in tomorrow. And, tell people you care about and love to watch this show because they probably need to in order to survive COVID-19. I hope that you'll be well and that your children will be well. And I'll look forward to seeing you tomorrow. Bye.